Dear students, in this lecture we will talk about the internal features of the heart. I am Dr. Mariam Asad, an associate professor at the Anatomy and Embryology Department. By the end of this lecture, you are supposed to describe the internal features of each of the heart chambers, enumerate the openings related to each chamber, and define the orifices connecting the chambers together with the related fibrous rings. Explain the cardiac valves as regards their structure, the number, and the names of their cusps. So let's begin with the interior of the right atrium. The right atrium is divided using a muscular ridge known as the crista terminalis. This crista terminalis, you have seen it on the outer surface of the heart, and it is known as the sulcus terminalis. The crista terminalis from the inside of the right atrium divides it into an anterior rough part. The roughness of the anterior part is due to the elevated myocardial muscles over the surface of the wall. These elevated myocardial muscles are known as the musculi pectinati. Whereas there is the smooth posterior part of the right atrium, which receives the openings of the main veins of the body. The first one is the opening of the superior vena cava, which receives venous drainage from the upper half of the body. And the second opening is the opening of the inferior vena cava that receives the venous drainage from the lower half of the body. And the opening of the coronary sinus. The coronary sinus is the main venous drainage of the myocardial muscle. Added to all this, the right atrium receives openings of small veins directly into its wall, which is known as the veni cordi minimi, as well as the anterior cardiac veins. When we take a look at the interatrial septum, the interatrial septum is the wall in between the two atria. We find from the right atrial surface, we find that there is a very small depression, oval in shape, on the right side of the interatrial septum known as the fossa ovalis. This fossa ovalis is bounded above and on the sides by a raised margin or an elevated ridge called the annulus fossa ovalis or the limbus fossa ovalis. The fossa ovalis is actually related embryologically to the foramen ovale, which used to allow blood in between the atrium in the intrauterine life. As we go down, or as the blood goes down from the right atrium to the right ventricle, it has to pass through an atrioventricular opening, which means an opening in between the atrium and the ventricle. On the right side of the heart, it is guarded by a tricuspid valve. We will talk about this later on. Inside the right ventricle, there is a supraventricular crest or an elevated part which divides the right ventricle into an inflowing rough part that receives the blood from the right atrium. This blood is, of course, non-oxygenated blood, and it has rough walls. This roughness is due to, again, elevated myocardial muscles over the wall of the ventricle. But remember, we called these elevated muscles in the atrium musculi pectinati, whereas in the ventricles we call it trabeculi carni. As these muscles continue to elevate over the surface, they form what is known as papillary muscles. The right ventricle has 3 papillary muscles, one coming from its anterior wall, so it is called the anterior papillary muscle, another one coming from the posterior wall called the posterior papillary muscle, and another one coming from the interventricular septum known as the septal papillary muscle. These papillary muscles are very important in the mechanism of the working of the tricuspid valve. Another feature inside the right ventricle is the moderator band. This moderator band crosses the ventricular cavity coming from the anterior papillary muscle to become attached to the ventricular septal wall. It has a very important function as it carries the right branch of the AV bundle and it prevents the overdistension of the ventricle during the diastole. Continuing through the interior of the right ventricle, as we said, it has an inflowing rough part and then the outflowing smooth part which goes above the supraventricular crest. This part is known as the infundibulum and it is considered to be the beginning of the pulmonary trunk. The pulmonary trunk takes the blood from the right ventricle and moves it towards the lung to become oxygenated. The pulmonary trunk has a pulmonary orifice and of course it is guarded by a valve. Let's talk a little bit about the atrioventricular orifice on the right side of the heart, which connects the right atrium with the right ventricle. And it is guarded by the tricuspid valve. From its name, we know that it has three cusps, one anterior, then another one is posterior, and another one is septal cusps. The free margins of these cusps become attached to very tiny filaments known as chorda tendini, which in turn attaches the cusps to the papillary muscles, each one to a corresponding papillary muscle. The atrioventricular orifice between the right atrium and the right ventricle is actually a large orifice. It allows the admission of the tips of three fingers and it is surrounded by a fibrous ring or an annulus. We can find this in the right side picture in the slide. This ring is responsible for giving the attachment to the three cusps of the tricuspid valve. Let's talk a little bit about the tricuspid valve. The three cusps, as you know, are the anterior, the posterior, and the septal, each cusp of which is formed of a fold of an endocardium with a thin fibrous tissue in between. Each cusp has a base. This base is attached to the fibrous ring of the tricuspid orifice and a free edge which become attached to the tiny filaments known as the chorda tendini. Now we have to take a look at how the papillary muscles and the chorda tendini become attached to the cusps of the tricuspid valve. The papillary muscle is attached by its chorda tendini to two adjoining cusps. So when the cusps close the orifice, the chorda tendini prevent the eversion or the ballooning of the cusps towards the atrium. In other words, the chorda tendini keep the cusps in position and prevent their ballooning. So the anterior papillary muscle, which arises from the anterior wall, its chorda tendini are attached to the anterior and posterior cusps. The posterior papillary muscle, which is smaller and arises from the posterior wall of the ventricle, its chorda tendini are attached to the septal and posterior cusps of the tricuspid valve. Whereas the septal papillary muscle, these are a number of small projections from the septal wall, the chorda tendini of which are attached to the anterior and septal cusps. Now let's talk a little bit about the other orifice inside the right ventricle, which is the pulmonary orifice. It's around 3 centimeters in width. It connects the infundibulum of the right ventricle with the pulmonary trunk, thus taking the blood, as we said, from the right ventricle towards the lung. It has to be surrounded by a fibrous ring to keep its shape, and this fibrous ring gives the attachment to the three semilunar cusps of the pulmonary valve. The three semilunar cusps are actually divided such that one is posterior and two are anterior. And to differentiate between the two anterior, we see one of them on the right side and one of them on the left side. The structure is similar to each other. They have a base and an edge or a free edge or an apex. The free margin of each cusp, this is the important one. The free margin is called the longule, and it has a middle thickened part called the nodule. However, the free margin is devoid of any chorda tendini. So the pulmonary cusps do not attach to a chorda tendini. Opposite to these three cusps, the wall of the pulmonary trunk presents three dilatations. These dilatations are called sinuses. As the ventricles contract and the interventricular pressure rises, blood is pushed up against the semilunar valves, thus they are open. Whereas when the ventricles relax and the interventricular pressure falls, blood flows back from the arteries, filling the cusps, and thus the semilunar valves are closed. So we notice that the mechanism of closure and opening of the semilunar cusps of the pulmonary valve are different than the tricuspid valve. Now let's take a look on the interior of the left atrium. The left atrium is actually all smooth except for a very tiny part inside the left auricle, which has musculi pectinati. So it's only the left auricle having musculi pectinati. The left atrioventricular orifice, which allows the blood between the left atrium and the left ventricle, is guarded by a bicuspid or a double or two cusps valve. We call it the mitral valve. This is the mitral valve cusps. The veins that open into the left atrium are the openings of the four pulmonary veins, two on the right side and two on the left side. These pulmonary veins bring the oxygenated blood from the lungs to the left side of the heart, as well as the tiny openings of the veni cordi minimi that open in the right atrium as well as the left atrium. Now we go down towards the left ventricle. The left ventricle is actually has a wall that is 3 times thicker than the right ventricle. And why is the question that arises now over the slide. Actually, the thickness of the left ventricle is very important because it pumps the blood against the aorta, which distributes the blood towards the whole body. So it needs thicker muscles. The cavity is divided as well into a rough inflowing part receiving the blood from the left atrium uh, and a smooth outflowing part which leads to the aortic orifice. The rough part is due to the trabeculae carni as well as in the right ventricle. The trabeculae carni, as we have said, are elevated myocardial muscles over the surface of the wall of the ventricle. And the elevation continues. It forms two papillary muscles. The papillary muscle coming from the anterior wall of the left ventricle is called the anterior papillary muscle, whereas the papillary muscle coming from the posterior wall of the left ventricle is called the posterior papillary muscle. Inside the left ventricle, there is no moderator band. Let's take a look over the smooth outflowing part, which we call the vestibule. Just a small reminder, the outflowing smooth part of the right ventricle is called the infundibulum, whereas the outflowing smooth part of the left ventricle is known as the vestibule. It is considered to be the beginning of the aorta. It is fibrous and has no muscular tissue such that it remains patent or opened during the ventricular systole, thus allowing the blood to pass from the left ventricle to be distributed over the body. And then we talk about the atrioventricular orifice of the left side of the heart, which lies between the left atrium and the left ventricle. It is smaller than the right side, and it only admits the tips of two fingers. It connects the left atrium with the left ventricle and surrounded by a strong fibrous ring, which is called the annulus. This ring is the one responsible for giving the attachment to the two cusps of the mitral valve. If we take a look at the mitral valve itself, we find that it is formed of the two cusps, one anterior and one posterior, corresponding to the walls of the ventricle. The anterior cusp is larger and lies anterior and slightly to the right side. The posterior cusp lies posterior and slightly towards the left side. It has the same structure as those of the tricuspid valve, but larger and stronger. This is the bicuspid valve with the anterior cusp and the posterior cusp. Let's take a look at the opened mitral valve. When the left ventricle is dilated, the papillary muscles are relaxed. The chordae tendineae in return, they are also relaxed, and so the mitral valve is opened. So blood passes from the left atrium towards the left ventricle. However, when the left ventricle contracts, the papillary muscles become tense, the chordae tendineae become tense as well, and this causes the mitral valve to close. So the blood flows from the left ventricle towards the aorta. And then we talk about the aortic orifice. It's 2.5 centimeter wide and connects the vestibule of the left ventricle to the ascending aorta. It has to be surrounded by a fibrous ring as all the orifices, and this ring gives the attachment to the three semilunar cusps of the aortic valve. In the aortic valve, it has one anterior cusp and two posterior cusps, one on the right side and one on the left side, the structure of which is similar to the pulmonary valve. The aortic valve, each cusp has a dilatation above it called the aortic sinus. As we notice that the anterior aortic cusp and sinus and has an opening. This opening gives origin for the right coronary artery, one of the major arterial supplies of the cardiac muscle. And this is the left posterior aortic cusp and sinus. It has another opening which gives origin to the left coronary artery, the other main branch supplying the heart. And this is the right posterior aortic cusp and sinus. It gives origin to nothing. So we only have two coronaries, right coronary and left coronary artery. Now we talk about the surface anatomy of the cardiac valves. So anatomically, we can see the site of the valve. However, it can be best heard over another area. We call this area the auscultatory area. So if we talk about the pulmonary valve, its surface anatomy, it's anatomically present at the third left sternocostal junction. However, it can be best heard at the medial end of the second left space, intercostal space, of course. The aortic opening, the aortic valve, we can find it anatomically at the third space, left sternal border. However, it is best heard, or its auscultatory area is at the medial end of the second right intercostal space. The mitral valve is present anatomically at the fourth left sternocostal junction, but it is better heard at the apex of the heart, which is the left fifth intercostal space, 3.5 inches from the midline, or 9 centimeters, of course. And last, the tricuspid valve is anatomically present at the fourth space behind the center of the sternum. However, it's best heard at the xiphisternal junction to the left of the sternal border near the fifth space. This is the auscultation position for the valves that we just mentioned: the pulmonary valve, the aortic, mitral valve, and the tricuspid valves. Let's take a look over the interventricular septum. This septum, from its name, it's obvious that it lies in between the ventricles. The interventricular septum lies obliquely towards the left side. It is formed of a lower part, which is a muscular part, and an upper membranous part. Thank you so much for your attention.